All right, so today I'm going to be talking about myocardial infarction and what that is and a couple of different other factors for us today. So what is myocardial infarction? Most people know infarction as heart attack, which most literally means death of the heart muscle. So you might be wondering how this happens. This is caused by a blockage of one of the coronary arteries, and the coronary arteries supply the myocardium, the muscle tissue around the heart, with blood. So thus, the blood cannot get to the heart, which causes a decrease in oxygen in the heart muscle. And when things don't have oxygen, they do die. So how does a person get myocardial infarction? Well, it can happen a number of different ways, and it's likely to happen more to people who have certain risk factors. And some of those risk factors include obesity, high blood pressure, high cholesterol, a family history of heart attack, a more sedentary lifestyle, or a type A personality. These things just increase the probability of getting a heart attack. However, myocardial infarction can happen to just anyone. So to be aware of it is very important, both in our practice and in others. So how does it affect a person in the body structure and function level? Because it most literally means death to the heart muscle, it causes death to that tissue in the heart and affects the heart's ability to work and contract and push that blood throughout our body. So how prevalent are heart attacks in the United States? They are very common. 790,000 Americans have a heart attack each year. So a study I looked at broke it down in a couple of different age ranges here. So one thing they did say was that males do have a higher risk, and as we age, the risk also increases. So as you can see, as the age increases on the left side, the percentages also increase, and that percentage just stands for the percent of the population that the heart attack occurs in. So as you can see, 80 plus, it's at about 17.3% of heart attacks occur then. Furthermore, I'm looking at ethnicity. Black males are at a higher risk than other ethnicities to have a heart attack. Just to quickly go over some medications that are used for people who have MI. Some antiplatelet, antithrombotic agents, they both help with reduced clotting. And then vasodilators lessen pressure on vessel walls. And beta blockers also help out with MIs by slowing the heart rate down. So I just have a couple of examples of each underneath. So the first study I looked at that's more relevant to the physical therapy world is when is the best time to mobilize patients after myocardial infarction? So currently what this study had shown is that there were no guidelines in place on when to do so. There's a pretty broad range. So normally patients are mobilized within 4 to 28 days after the acute MI. So as you can see, that's pretty broad. So they tried to get it down to a smaller day range. So they split them up. I believe it was 4 days and then after 4 days post. And what they found was there was really no difference in the effects on when. So I think that the earlier mobilization has shown to decrease mortality, depression, and heart rate variations. So the sooner they get up, the better. As for the second study, 6-minute walk test, it was pretty similar to the first study that I found, except it was using the 6-minute walk test specifically. So it was used after an acute MI, 4 days post, and beyond 4 days post. So that's how they split these patients up. And there was no difference found in adverse effects between the two groups as they did the 6-minute walk test. So like I had said before, the earlier the mobilization, that could be better for these patients. And finally, the relevance to our top 20 in system screening 3. MI applies to a good portion of the top 20. As we know and have learned, atherosclerosis, the hardening of those walls from plaque formation and macrophage mobilization to those areas is one of the main causes of myocardial infarction. So that is number 3 and 4 in our list. Risk factors in 4 also lead to an increase of MI, so I had listed that earlier in the presentation. And then it even has its own number at number 9, just talking about some of its complications such as dysrhythmias. Here are my references, so if there are any questions, just leave a comment below, and thank you for watching.